that we have today. So our first presenter today is Ximena Baca. Ximena Baca is a massage therapist and has taught in the School of Health Science massage therapy program at Miami Dade College since 2013. She holds a master's degree in adult training and education from Phoenix University and a master's degree in anatomy and physiology instruction from New York's Chiropractic College. Ms. Baca completed AQ's effective teaching practice in 2016. So welcome and thank you for joining us, Ximena.
I can't hear anything. Am I alone?
No.
Yeah, Ximena, I think we're having some sound problems. Ximena?
I can see Ximena, but yep, she's having an audio.
She's not muted.
Nope, she is not muted.
Ximena, my headphones have a second mute button right here. Check, check whatever you've got, because it won't show up on the screen. Yeah.
The other thing you can try, Ximena, is next to your microphone, if you click the up arrow, you can see where the sound is, what microphone you're using.
Is the one that...
There you...
Can you hear me?
Yes.
Yes.
Yes. Perfect.
There you go.
Welcome, Ximena.
But I don't
Welcome
hear
back.
you in my headset anymore.
But can you hear us through the computer?
Yeah, can you hear me through the headset?
Yes.
We can hear you. I don't know how we can hear
you.
you.
To wear it. Yeah, you probably are good without it.
Okay, so I'm just going to take it off.
Yeah.
Okay.
No,
I think it was better with it on.
I think it was better with it on. I think it was working better.
Okay, you can hear me better now?
Much
Yes.
better.
Okay, so I'll keep this on and hear you in my computer. Great.
Perfect.
Okay, so you missed everything I said. This is crazy. Now let me start again. I gave one of the best introductions, but it's okay. Well, thank you so much for that, Jody, for presenting me. This is one of the nicest introductions. But I have to say that as a massage therapist, there is a stigma attached to my profession. You hear the word massage and people go, So that thought as a professor inspired me to develop a checkoff list or a rubric to align them to the course learning outcomes and to help my students in doing proper SOAP note documentation. Have you ever heard of a massage therapist documenting your sessions? If you've ever had a massage? Is not as common as you would think, and I feel that this is what will help my profession be seen a little bit differently when you see a massage therapist document your session. It is a treatment plan. What is a SOAP note? SOAP note stands for Subjective, Objective, Assessment, and Plan. This treatment plan is utilized by the massage therapist student, which my hope is that they can transfer this when they graduate and continue this habit. I feel that with that idea in mind, I meet my goal, which is to elevate our profession because now they're seeing us documenting. In that, who is my learner? My learner is most likely entering the massage therapy profession as a second career. They're more likely members of a professional organization. They may be a practitioner in a different field who will likely provide massage therapy in a healthcare setting or in their own office. My learner is also an adult and first-time college student who has no idea how to do any of the learning outcomes, how to align anything. So it is my job to really walk them through this process. They're learning a new vocation. They heard the calling to be part of this wonderful profession. That's who my learner is. Next. And so what is my modality? How am I using this remotely? The modality I've chosen for the students in my class is called transparent assessment. Transparency is very important in this profession because the students take everything literally word by word from me. And it could not have come at a better time because I'm actually doing it right now in this semester. And due to the new normal that we have, it's giving me an opportunity to expand and change from how I used to deliver it, which was just once or twice a week face to face, and we had no more communication. With a more asynchronous fashion, the students can continue to revise the work. And when we finally do meet, they get to interact at the same time. They get to see each other twice a week in the lab. They get to receive practice and instruction feedback in real time from their partners and from myself, while they're gaining a better understanding of the assignment. And what is the assignment? Based on the work of, and please, I'm going to try to say the last name correctly. I said it like 10,000 times over the weekend. Based on the work of Dr. Mary Ann Winkums, yes, transparency in learning and teaching, also known as TILT, describes that the transparency design is to explain these three items that you see before you: the purpose, the task, and the criteria. The purpose of the transparent assessment falls into two categories. Because we're a hands-on approach of delivery, I need my students to learn those skills, and by practicing, by completing them, and then correlating them to their note taken. Two is the knowledge they gain because you learn by doing. It's very kinesthetic. You're massaging, you're learning the technique, you write it down, and you make connections. Under the task, it will be helpful that the students and myself, we discuss how to construct the assignment in terms of what steps to follow, what works, what to avoid, and definitely be able to spend quality time producing quality work. Under criteria, the criteria for their success will depend on the conversations we've had before, and this will have the students ready to do good work. Let me tell you, I'm anticipating how this work is going to look. I wish I had that data to give you, but it's going to present itself in a couple of weeks. So I'm looking at their work, and I have a very nice, one of my slides will present some of the work that is happening right now in the class. So why have I chosen it? And as you can see, my enthusiasm is beyond my own persona. I love having this communication with the students. And so when this assessment came on and the opportunity came on to put it together, and then the opportunity to present it, I was in heaven, because I'm able to now transfer this information and literally say it. This is why I'm doing it. I could explain it to the students, but since I have a wonderful group of other colleagues here, you will understand why I'm doing this. And really, the purpose is to facilitate the objective of the assessment. I really want my students to be able to engage in conversation, which is important for me. When I see my students engage in conversation, there's an anchor. The moment I see that anchor, it increases their engagement in the assignment. They get to talk, they're working with one another. Not only is the student looking at the assignment and saying to themselves, how do I translate this component of my hands-on application on actual words? Well, they have to know how to learn medical terminology. They need to learn how to use short words, because there's not that much room to write a whole note. And so this only supports their development of that design, right? And when they combine the skills, the ones they learn in the lab, the ones that they practice with one another, they even get to practice it on me. They get to think about the in and out of class activity. They develop their own treatment philosophy. And that is like the aha moment when I see it in my students' eyes. They're like, oh, I get why I'm doing this. This makes sense. And it's all about recalling information from that feedback they have gotten from me or from other professors or even their own classmates. And when they spend less time in a trial and error phase, trying to figure out why the assignment matters and how to approach it, they get to spend more time focusing on what is important, especially in the concepts of the SOAP note, which in the end, it gives them time to master essential skills and content knowledge. So I want to follow up with what Jody said earlier regarding the cognitive levels. I took the liberty to copy paste and do a very pretty thing here and really highlight the beginning, increasing the students' cognitive. But in terms of massage therapy, I selected these three because I felt that they align better for me. In the aspect of remembering, the student has to recall information and how to use their skills in the lab. So if you show up, if you present with a tight hamstring, how am I going to handle this? I let my student think, maybe I'm going to put a hat back on this client and then see how the tissue relaxes and make it more pliable for me to work with. By doing this, they're recognizing the benefits of another item that they can treat the client with to prevent any injuries, because as massage therapists, if we don't know what we're doing, we can hurt you. So that is one of my goals. I want you to be very careful. This is what I tell all my students. And then I need them to understand what they're doing. So the client sees a diagram of the human body and they point and say, these are the areas I need treatment on. Well, this is a guide that the student receives. Then they're able to explain it to the client, how the treatment will go, how it will move forward, and then be able to paraphrase what the client is saying to them. We need to mirror what they're saying so we avoid making mistakes for medical error purposes. We don't want to hurt anyone. And then finally, the application. The SOAP note is one that has to be constructed by following specific steps. After they have identified and interpreted the client's subjective information, then the student can add their observations, their findings, and then explain the length of the treatment, analyze what worked and what didn't work and what to avoid. And then lastly, give the client homework. We give them homework. We want them to rest, sleep, and stay hydrated. Let me continue on the next slide. This is what I've done, how I have conducted it. The student receives a clean SOAP note chart, as you can see here, along with the rubric. And right above it, they have the in and out handout, the class handout. So when I refer to the therapist and the client, you know that I'm referring to my students. So a student client will complete the intake form. The therapist will review it, revise it, and then ask key questions, do the assessment. Then the client is invited into the massage lab, receive a full treatment, and when it ends, they get to sit down again, and that's what's happening in the in-class. When the massage is over, the student can go home, review their notes, and now they're doing the out type of work. They're doing the out of classroom activity. We then sit down and see what points actually matter here. And then this is a big comparison that we do together. And what have I learned? Oh my goodness, everything. These are actual photos of my actual students that I wanted them to be part of this presentation. That's why it matters so much to me to align all of this together. And this is what it looks like. If you remember what the other one, the clean, plain sheet of paper looked like before, this is the end result. Here you see the students working with each other. They're doing this conversation. And what I know is this: when the students do a job that meets your expectations, it's a transparency of yourself. It says a lot about you as a professor. You were clear, you were concise, you were available, you were there for them, either synchronous or asynchronous. It is one of those aha moments. So I really look forward to what is going to come up in a couple of weeks when they have to turn in their assignment. This is the example they see. This is exactly what I expect from them. And you know what? At the end of the day, isn't that what we want? Quality work, but it is based on how we express it. I want to say thank you so much for the opportunity. I hope I met your expectations and I gave you something to work with. The In and Out is a wonderful tool, and I would be happy to answer any questions you have for me.
Thank you, Ximena. We have a couple of questions in the chat, and I'm going to encourage others to go ahead and post while we work through these first couple of questions. So first of all, how has your approach to assessment alignment changed as we've moved from a face-to-face or pre-COVID context to our remote current context?
Perfect. I like that question. So before the pandemic, if a student missed a lecture or lab, they would not be able to catch up. That is very true. And it would concern me very much, and I'd have to find ways around that. So let me tell you though, the massage component has so many steps. And if a student learns to place their hands on a client, they need to make sure that they need to be centered, they need to be themselves and quiet their mind. That's difficult to do if you miss class. The approach to massage is very organic. It's not easy to duplicate. So because a case may present during demonstration. So if a student misses a class, all they get is just the notes and this is what we did, but that moment is gone. So by now doing this remotely, I can record the class. I can then communicate with the student. I am seeing the advantages because it offers me the ability to align my lab and my lectures with my learning outcomes. So it facilitates that for the student. That's the benefit of it for me. There are no more excuses, actually. It's like, oh, I missed class, couldn't come. Really? But there was the recording. There was the video we post. I'm available to you. You know how to get a hold of me. So that has actually been to my advantage. I love being in the campus, but I also like how this is helping me be a better and more approachable professor.
Thank you. And another question is about the criteria for success. How do you communicate the criteria for success on assignments to your students?
So everything is a habit, and I've been in the habit for a long time because of AQ training to develop rubrics. Rubrics to me are that binding document between me and the student. They know exactly what to do. So I make sure that I give them a rubric. There's a rubric, a handout rubric. I try not to give them too many paper rubrics or handouts, but it's in our Blackboard discussion. It's always readily available to them. The only way a student could fail is if they don't really pay attention or they're not aware that they have everything available to them. They just can't believe everything is available to them. And that's what I believe transparency is about. Putting things out there for the student to see.